There are populations across the world COVID-19 vaccines are struggling to reach. Some of the world's poorest countries and communities are also some of the most jab-wary. Countering deeply held beliefs is a tall order, especially when historic inequality in healthcare itself is partly to blame. But one campaign in Berlin is paving a way. How can skepticism in these groups be overcome? Hello and welcome to your COVID-19 special. I'm Chris Colbert in Berlin. Here in the German capital, the vaccination campaign across the city's refugee shelters was delayed, in large parts because of supply issues, but also by the spread of misinformation, mainly on social media. With the help of an education campaign, vaccination take-up is now increasing.
Back to a little normality in this refugee shelter in Berlin. Sewing classes resumed today. The inhabitants are delighted. For most of the pandemic, their home was very, very quiet. I was in touch with many people before Corona and I used to go out a lot. But now I cannot meet up due to the pandemic. It is very difficult for me. I want the pandemic to end so we can have contact with other people again. But although some residents know that getting vaccinated helps protect others and might end the pandemic, most are wary of getting the jab. That's why this group of doctors, social workers and interpreters visit refugee homes to convince the most reluctant to sign up for an appointment. Many people were very afraid they would become infertile or get thrombosis. This was much discussed in the media, which also stirred up fear amongst the residents.
Thematisiert und dadurch wurde natürlich auch die Angst bei den Bewohnenden geschürt.
Due to the high risk of infection in shelters, refugees were almost top priority in Germany's vaccination efforts. But various delivery bottlenecks and approval issues have delayed the campaign. Even though this is now sorted out, social workers says it takes a lot of convincing for people to take the jab. It is important that you make them feel acknowledged and show there's no wrong question. And we use interpreters, so refugees can ask questions in their native language, articulate themselves better, feel more at ease in the conversation. By the end of the afternoon, the doctors have met with around 20 people. Face-to-face contact is key to success. In some refugee shelters, readiness to get vaccinated has jumped up to 80% as a result of the information campaign.
For more, let's bring in Lena Simet. She's a senior researcher on poverty and inequality at Human Rights Watch. Welcome to DW, Lena. In our report, we just learned about the reservations people in refugee camps have towards getting vaccinated. Do you see a similar pattern with people living in other precarious conditions?
Thank you so much for having me. I absolutely do. So what we see is that the high inequality, especially economic inequality, that existed before the pandemic has really translated into concerns in terms of access to vaccines and also the interactions with governments, since many of the populations had been left behind by governments for so many years and decades. So this is really not unique to refugee populations. In fact, in the United States, we see that Black and brown people often who had disproportionately higher infection rates initially also had more hesitancy towards the vaccine out of the fear of cost. So what are some of the cost implications? But also due to a long-standing neglect of the government and mistrust in the government.
Now, these vaccination drives, nevertheless, are part of the reason why the economy, at least in many countries in the West, is picking up again. But you say that low-income households are at a particular disadvantage in that recovery. Why is that?
It certainly depends on the country context, I would say. Interestingly, even to take a step back, I think what we see is that the global inequality, meaning inequality between countries, here is a huge risk that low-income countries will be falling further behind, as we see this inequality in access to vaccines, with higher-income countries having hoarded much of them and now having disproportionate access to them. But at the country level, there have already been signs of the lack of transparency in access to vaccines, corruption that often favor certain groups in getting access earlier. And here, low-income people have been disadvantaged. Another reason why is that in low-income communities and neighborhoods, healthcare is often lacking and is not available to the same extent. So people have to travel far distances to reach a healthcare center and get access to the vaccine.
If we look at the economic impact of this pandemic, millions have lost their job during this time of crisis around the world, particularly in the service sector and in low-paying jobs. Now, with economies reopening, won't these opportunities for people come back?
Not necessarily. And what is very concerning is that we saw that especially low-income jobs have been lost at a much higher rate than well-paying jobs. And one of the concerns is as countries open back up, those won't come back to the same extent. We've seen this in previous crises and recessions. After the 2008 crisis, for example, we saw that many of the low-paying jobs have not come back, and many people who were pushed into poverty or unemployment did not necessarily get rehired once the country recovered. And so one piece that we're really pushing for is for countries in the recovery phase to consider the employment effects and the long-standing effects, especially on low-income people.
Now, speaking of recovery, to varying degrees, governments have been trying to support people that have been particularly hit by the pandemic. Are you worried that this sort of support could be a one-time effect?
Very much so. It's been an extraordinary year, and we've seen countries respond to the crisis in ways they never have before. So the amounts of money that have been poured into relief programs, into stimulus packages, has been quite impressive. But we at Human Rights Watch, we've done analysis in about 24 countries, and about the relief programs, and what we've seen is that many measures were highly temporary in terms of cash payments that received populations at one time. But aside from that, we are also concerned as countries have taken on more and more debt to finance these recovery and relief programs, that as countries have to service these debts, they will introduce harsh austerity programs that are harmful to human rights. They may rely increasingly on the private sector to deliver essential public services such as healthcare, education, and they may conduct further cuts to social protection programs that are so essential to protecting people from poverty and inequality.
Lena Simet, Senior Researcher at Human Rights Watch, thank you for your thoughts.
Thank you.
And up next is our science correspondent, Derek Williams, answering your questions about the pandemic.
How does COVID-19 tend to affect young adults?
There are two facets of this multifaceted question that I'd like to talk about. The first is, of course, the straightforward issue of what the virus does physically to an average young adult as compared to someone who's older. And there, the statistics tell a pretty clear story. COVID-19 mortality increases dramatically with age. Let's look at recent data from the US. More than 4 in 5 deaths there have occurred in those over 65, and fewer than 1 in 200 reported deaths have been in people under 30. But as vaccinations rise among the elderly in countries like the US, doctors say that the average age of patients who are being hospitalized with the disease is dropping dramatically, and that many of those younger patients will end up with conditions like crippling damage to the lungs or the heart. So although COVID-19 is a lot less likely to kill a young adult, there are still really pressing reasons to get vaccinated because getting it can have devastating long-term health consequences. The second important facet of this question is the pandemic's emotional, social, psychological, and economic impact. It's affecting everyone of every age, but as experts say, in many ways, hitting young adults especially hard and at a key time in their lives. They're now warning that due to lockdowns and other measures, Generation COVID is facing shortfalls in opportunities for crucial self-development. Many young people are rising to the challenges, but psychologists and other therapists in many places, like here in Germany, are also currently being overwhelmed by this tidal wave of young adults in need of help. And a lot of those professionals now say that even the serious toll taken by infection in today's young adults could in the long run be overshadowed by the impact COVID-19 has on the group's mental health.
And before we go, Taiwan has produced its first homegrown COVID-19 vaccine. Medigen Vaccine Biologics has applied to the Taiwanese government for emergency authorization of the jab. Taiwan is currently facing a surge of domestic infections, made worse by a shortage of vaccines. Less than 5% of the population have so far been inoculated. That's our show. For more, you can always hit our website at dw.com/COVID-19. I'm Chris Coburn, Berlin. Thanks for watching. Stay safe.